The United States is inching closer and closer to a record 5 million coronavirus cases, numbers several experts believe are as a result of several factors, including the way the federal government handled it from the beginning. Joining us now to speak on the country's fight against COVID-19, the practical implications of daily life and the medical community at large is Dr. Mike G. Martin, Associate Professor of Medicine at the University of Tennessee Health Science Center. Welcome to the morning show here on Arise News. Now,
Good morning.
It came to us on Thursday, the world's hardest hit country, being the United States, seeing a major coronavirus resurgence since the end of June, adding over 2,000 deaths in 24 hours alone. I mean, it's unimaginable how those numbers could just go up so suddenly. Can you paint a picture of what that's been like?
So I think it's actually been very interesting the way that it has rolled out in the United States. From my point of view, I mean, as a doctor who practices and sees patients constantly, it really started in March in the more populous areas of the United States, up in New York City, for example, where it essentially exploded. The numbers went through the roof, but those were very population-dense areas, and the country quickly did go into a lockdown, canceling schools, sporting events, and everything else in mid-March. And it was largely contained to the more metropolitan areas at that time. But it didn't really materialize in less urban areas like where I live. I live in Memphis, Tennessee, which is a city of about 1 million people, which is dramatically smaller than the larger, more urban areas. And though we canceled all elective procedures, we had plans to have makeshift hospitals, nothing really emerged down here in a significant way. And as the entire country went to lockdown, then we saw the economy going downhill dramatically. I actually think that people more than anything lost patience with it. The virus continues to smolder. Now it's moving into areas more and more like where I live, where our positivity rate's right around 14%. And I just think it's an ongoing smolder, and there's a lack of a unified federal response. Things are left up to the local city councils, mayors, governors, and there's a lot of contradictory information on how to actually handle and respond to the virus. So I guess the way that I believe that it's increasing is a lack of a unified response. And the fact that we did have a very good response at the beginning, but when it didn't really leave the major urban centers as fast, people in the more rural areas or cities of around 1 million people got frustrated with the economic implications of it and have basically thrown caution to the wind and started going about life in daily routines, such as going out to eat and everything else, which is then only spreading the virus more. So that's how I believe that it has surged.
How much, I know you touched on it earlier about there being so many layers of governance in the United States. You definitely got your federal response with the president and his administration, but then you've got state governors, you've got mayors, and so on and so forth. And you've highlighted the difficulty people have been faced with when it comes to what type of information they're supposed to follow. But if we go to the very top of the food chain and look at the federal level, have you been satisfied with the response so far? I know that United States geographically seem to have a bit of a head start looking at the rest of the world, seeing China, how it was happening there when it spread into mainland Europe and Italy. It feels as though the United States had some time to readily prepare for the onset of this virus. At this point, do you think you're satisfied with the level of care and preparedness from the federal government?
No, because it was largely left to the local authorities to make all of those decisions. It didn't really come down from federal buying of supplies or anything else. Everywhere was left on its own to figure it out. For example, I round at 2 hospitals, and in the beginning, they would send out their daily amounts of personal protective equipment, what they were trying to do to get it, what vendors they were buying it from, and they were left to their own devices to find it. And though they were able to do it, and there was never any critical shortage, there was no clear response pattern or direction from the federal point. As far as mixed messages go, you get down to, like in Memphis, our city council calls for a ban on I mean, everyone has to wear a face mask to go out into public place. At the same time, the governor of the state is giving an executive order saying that American football has to continue, which makes it's just completely chaotic response because of a lack of strong federal leadership or precedent, in my opinion.
Definitely. I mean, I have to agree with you on there. Well, let's talk about the practical implications of COVID-19 in everyday life. I mean, you are on the front line. What other challenges are there in the diagnosis, the quarantine, and treatment of suspected or confirmed cases, even as the U.S. inches towards 5 million cases in total?
So I think a big problem is misinformation. Even in the beginning, it was, well, if you didn't have a fever and shortness of breath, you don't have COVID-19. So if you look at the data just from one of the two major hospital systems in my city, where they've been tracking and following the cases and trying to quantify everything, only a quarter of the people presented with fevers, and only around 40% of people presented even with any kind of chest symptoms who ended up being positive. So a lot of cases in the beginning weren't even being tested and weren't even being discovered. On top of that, the nasopharyngeal swab, I don't know if you've had the pleasure of having one of those yet, but those are horrific. It feels like they're going to tickle your brain. And in order for us to say that you're negative, you're doing 2 in a row in general. And a lot of people don't do the test right, I don't think, because they don't want to push the tube all the way up someone else's nose because it's extremely uncomfortable. So there's a lot of misinformation on just the symptoms and who to look for with it. And also asymptomatic carrier rates and quarantine is a big issue. In America, it seems like, and then again, as I see patients in clinic rooms every day, people are much more worried about, frankly, what they perceive as their personal liberty or decision to wear a mask or not versus the implications of it, ignoring the fact that a third of people are asymptomatic carriers of it who get infected with the virus, but they shed the virus at the same rate as someone who actually has fevers, chest pain, shortness of breath, and everything else. So you can feel perfectly well and be just as dangerous as someone who has a fever to the people around you. But when I go into exam rooms, half the time the patients see me come in the room, like, oh, good, now they take off their mask. That's the exact opposite of what they should do. Then I have to have the conversation with them. Then, unfortunately, they'll go into saying things, well, maybe this is all just a conspiracy. This is no worse than the flu, because the media in this country very much spins it in multiple different ways. It makes it hard for someone to follow along what exactly is going on. And then when you lose your job, when you've been stuck in your house for 6 weeks, your kids are not going back to school, and then you have one media outlet or multiple media outlets saying, hey, this isn't that big of a deal, then I'll actually have patients come up to me and tell me that this is all a hoax. And then so instead of talking to them about their cancer, I'm talking to them about how this is not a hoax. I've actually taken care of these people and had them die.
Goodness gracious. It sounds, it's actually quite hard for me to describe the feeling of that, because I can only imagine what you, a healthcare professional, would feel like when you're talking to patients at this stage of this pandemic, still trying to convince them that it is real, that it is deadly, and that you must protect yourself, even if you are not showing symptoms. It seems to be the case all over the world, where we're still, months after, continuing to put the information out there. But as I said, it's hard to find the words to describe how that must feel. Going by your day-to-day experience, though, is there anything comforting that you are experiencing? Do you feel like more people are taking it seriously? I mean, just on the streets of Tennessee where you are people wearing face masks daily, walking the streets? I know that, Tennessee being in the South, you're not at the epicenter. You're not in New York, for example, where you could imagine more people wearing face masks and it being more of something enforced upon the people there. But in the South, what would I see on the streets if I were to be taking a stroll down a street in Tennessee? Would I be seeing people in PPE or not?
No. The more urban you get, the more masks you'll see. But as soon as you start getting into the suburbs or any further out, you will not see that. Even though there's mandates. So like if you're actually in the center of the city, people will be wearing masks, and there are contract tracing enforcements, etc. But even that is not organized. For example, going out to a restaurant, they'll have you write down a list of each server will have a list of whoever they served that day. They'll take down your phone number and everything else. And then when you ask management about, okay, so what do you do with this list when your server gets COVID-19? They say, oh, we just file it away in case the health department asks for it. So there's no, again, federal mandate, larger response coordination or anything else. Right. So we'll have a cute little paperwork trail, but it won't actually, it's never actually enforced or followed up or anything else. Just like with mask ordinances, there's no one out there walking around telling people to put on a mask. And people are, I guess if you go into a restaurant or establishment, then yes. But other than that, no, not just walking around. If you walk around my neighborhood, I live in the center of the city, no one's wearing a mask unless they're going into a business. Oh, and then especially as you get more rural, not at all, even in businesses. We went out to a family lake house in Tennessee and went to a grocery store, and there's not a single mask to be seen.
Wow. That's very scary.
Gigantic flags.
Okay. Well, you know, let's talk. I mean, with a surge of cases like this comes a higher burden of the functionality of the existing medical systems. Now, can you speak to the patients with other diseases and health problems that are possibly getting neglected because of the focus on COVID-19?
So there's a big delay in elective procedures and elective screenings. All like mammograms, colonoscopies, at least in this area, stopped for 2 to 3 months. But all of that is really picking back up. We are nowhere near overwhelmed. So I think the big delay was just in elective procedures. And I think the other problem is the assumption that telehealth or remote medicine is an answer for everything, because there's a huge disparities across this country in people's access to and having electronics, cell phone coverage, and everything else. So I think that the people who are being left behind, I guess, are the poorer people who do not have access to the telemedicine, remote health, and everything else that we're doing. Because I work in the city, and again, you have people who are taking the bus to clinic and everything else and say, okay, well, don't come into clinic today. Call us on your cell phone, and they don't have a cell phone with voice chat, et cetera. And then again, elective procedures are being delayed.
This week,
we're not overwhelmed.
Okay, thank you, Dr. Mike. This week, going back to looking at Tennessee, because I feel it's a unique opportunity where we get the opportunity to speak to someone in the United States. So I wanted to focus on Tennessee itself as well. Oh, it looks like we're running out of time. I will ask my question. Do we have time or no? Okay, very quickly, if I could just talk to you about Tennessee itself. We know that you guys have more than 120,000 cases with just over 1,000 deaths. Tell us about the feeling, your own feeling, morale on the streets. Are people feeling anxious? Is there an air of uncertainty as it stands, or is it very much business as usual?
There's a huge air of anxiety, especially around schools reopening. That is by far where the vast majority of the stress and worry comes from, and from economic hardship more than people are actually worried about the virus.
Great, fantastic. Well, it is time for us to take a very short break. Once we come back, Dr. Mike Martin is still with us, and we will be able to continue asking questions. Please do stay with us. Welcome back to the morning show. We are still joined by Dr. Mike Martin over there in Tennessee. Thank you for joining us. Thank you for staying with us. We wanted to ask you, I know that we were cut off. You did actually, Doctor, you were able to give us a question to that. You were able to give us an answer to that question before the break. So I will ask you another question, considering that. If we were to take a look now, perhaps at schools reopening, do you think state by state, I'm sure that your answers would be dependent on which states and how serious the outbreak is in them. But generally, what do you think your opinion is on schools reopening at this point?
It is a huge area of contention and really lack of data. So my wife is a school teacher, and I have 13-year-old twins, and deciding how they go back to school. I mean, 8 of the 10 largest school systems in the nation are doing remote learning only. where my kids are going to school, they can either go remotely or part-time with a hybrid model with technology. But I think there's an enormous amount of unknown and uncertainty for all of this. The idea of social distancing and having a bunch of eighth graders wearing masks and staying away from each other, I think is really unrealistic. I also don't think we know what's going to happen when you get COVID-19 into school systems. I mean, it's been clearly reported that kids don't necessarily get as sick as adults or people with comorbidities or other medical issues. But at the same time, there are a whole bunch of rare syndromes that do come up with COVID-19. And just trying to put things in perspective, you could say, well, that happens very rarely. But if you go back to polio, flaccid paralysis from poliomyelitis happens to only 0.5% of people who get it, or children who get it, yet we vaccinate against polio and see it as a major health epidemic. And so saying, well, 99% of kids are okay who get COVID, that's still at the same rate that people got desperately ill from polio. So as we reopen the schools, I think it needs to be done with a lot of caution and a lot of double checking. And the thing is, each school system's really kind of making it up and going and doing it on their own. Even within this city, the independent private schools are opening up different than the city schools, which are opening up different than the county schools, et cetera. There's no unified leadership to it. So it feels like there's 1,000 little mini experiments going on. And I'm sure that's representative of more than just in Tennessee with our children. It would be nice if there was more of a federalized, coordinated response. I think it makes people very nervous because, again, we don't know. We've never opened up schools in COVID-19.
I mean, you did mention that your wife was a teacher and you have 2 twin girls. So I'm sure there are times that they do worry about dad when he goes out to the field to battle this very deadly virus. So I want to talk about the overload on doctors and, other healthcare professionals who are at very high risk already. How would you say, the doctors and the nurses are, making it through this very difficult time?
Firefighters run to the fire is something that we jokingly say. I think we're doing fine. We try to keep morale high, and it's what we signed up to do when we decided to be healthcare professionals. Yes, it's extraordinarily stressful. I think the things that are the most stressful is when there's mixed messages and unclear communication to the public, and we spend our time fighting disinformation. But as far as going in and helping sick people, that doesn't slow us down at all, I don't think. I mean, I've never considered not going to see someone because they had something infectious.
I wanted to speak to you about how seriously people are taking COVID-19 itself. We have been hearing reports of, on the one hand, people buying test results that would say that they are negative from COVID-19 so that they can go ahead with business as usual. Obviously, this is frowned upon. Obviously, this is not good. But how prevalent are false test results in the United States at this time? Have you been hearing of such cases?
I've heard of nothing like that, nor have I heard other than just conspiracy theories and stuff. But I've not come across that because there is no screening or testing. There's no checking to say, hey, do you have a COVID-19 test before you come in or not? Like when I walk into the hospitals, like I did yesterday morning, and I will in 4 hours, my screen as I walk in the hospital say, hey, do you have a negative COVID test? I say yes, and they give me a sticker and I walk in.
Right.
So if there was actually wide-scale testing or biological, like here's my certificate saying that I was negative, then I'm sure that counterfeit tickets and everything else would come up. But no, I'm not aware of any of that going on where I live, nor how it's even would it be enforced.
I mean, on Thursday, the World Health Organization, the director, the chief rather, Adhanom Ghebreyesus, came out to say that, vaccine nationalism is becoming a thing. I mean, at a point like this, a lot of countries are doing what they can to make sure that they get the vaccines out as soon as possible. However, people are beginning to see that some governments are politicizing the role that vaccines play in this. Now, as a medical professional and as someone who understands how important it is for the vaccine to be here in time, how would you react to this?
So vaccines should not be political. there should be intelligent, good testing and good vaccine development. There shouldn't be people rushing to conclusions, people rushing to distribute vaccines that are not proven. I've heard some world leaders talking about not waiting for clinical trials before distributing the vaccine to their populations. I mean, you need to prove things work before you spread them or tout them. That's what happened with hydroxychloroquine and azithromycin, where it was touted by some world leaders and others, and then has largely turned out to be useless. Though, I mean, I think there's a lot of anxiety to get the vaccine out, because that will give assuming that it's efficacious. First of all, you have to prove that the vaccine actually works before you distribute it. You have to prove that you don't have unintended consequences and side effects from it. Or at least you understand what those risks are, such as with like a live polio vaccine, there's a risk of actually getting polio from it. But there's all kinds of novel vaccine development strategies go into COVID-19, but really understanding how those are safety and how to distribute them is a scientific and a public health issue. It's not a political one. And I think it's very scary when people bring politics into public health decisions and bring misinformation or lack of scientific rigor into it.
Absolutely, but it does seem as though that has definitely been the case, where politics has often overridden medical expertise and the like, especially from the very top of politics in the United States, from the office of President Trump as it stands. So we are sadly running out of time. We've both enjoyed this conversation, and we wanted to thank you for your time with us today. Looks like we have come to the end of our time allotted to this segment. We've really enjoyed this conversation. So Dr. Mike Martin over there in Tennessee, thank you very much for joining us today.